and welcome to our webinar series showcasing the outstanding work of community agencies across New York State funded by the New York tax checkoff dollars to reduce mental health stigma. I'm David Minot, Executive Director of Mental Health News Education, publisher of Behavioral Health News and Autism Spectrum News. I'm honored to have the opportunity to highlight these impactful projects and share with you the details of this important stigma reduction work. This series of webinars aims to highlight the innovative efforts of 7 organizations funded by the New York State Office of Mental Health for Stigma Reduction Community Initiatives in 2022 and 2023. We'll learn how these agencies identified targeted audiences within their regions, tailored their engagement strategies, and chose their interventions to address specific types of stigma impacting their communities. Stigma remains a significant barrier, discouraging individuals from seeking mental health support and limiting opportunities for those experiencing these challenges. However, local community providers possess invaluable knowledge about the populations they serve, positioning them uniquely to develop the most effective anti-stigma interventions through tailored outreach, marketing, education, and contact-based efforts. Over the course of these 7 webinars, we'll dive deep into the real-world experiences of these agencies to explore their methodologies, the challenges they faced, and how they measured the impacts of their interventions. Their stories offer a wealth of insights for other organizations looking to implement successful stigma reduction initiatives in their communities. We will also examine the key elements essential to any stigma reduction project, including understanding the target audiences, defining engagement strategies, setting clear goals and deliverables, and developing mechanisms to evaluate both qualitative and quantitative outcomes. Ultimately, these webinars aim to stimulate broader interest and collaboration in the fight against mental health stigma and increase mental wellness across New York State and beyond. We will include contact information at the end and encourage you to reach out to today's speakers to discuss how you can replicate a similar project in your own community. By fostering community coalitions, we can amplify our collective efforts and drive meaningful change. Today you'll be hearing from Lauren Gonzales, Assistant Professor in the Department of Psychiatry at Columbia University Irving Medical Center, and Dana Collins, Director of Counseling and Psychological Services at St. Mary's College of California. Once again, thank you for joining us and enjoy today's presentation. Can you provide an overview of WeSpeakNYC's OMH-funded mental health anti-stigma campaign?
Sure. So our project, the primary aim was to develop culturally relevant tools for combating mental illness stigma in BIPOC communities in the New York City area. And we wanted to do this by using what's called a community-based participatory approach. And so what we decided to do was to first initiate partnerships with 3 mental health organizations that are located in different New York City neighborhoods with large BIPOC communities. So this included Brooklyn Community Services in East Brooklyn, Services for the Underserved in East Harlem, in Manhattan, and then also Montefiore's Medical Center's Bronx Health Collective, which is located in the South Bronx. And we started by kind of holding what we called open community discussions at each of these partners. And during these discussions or meetings, we basically just solicited community member ideas on, if we're creating this toolkit for their communities, what did they think would be important to put in the toolkit? And this included, different ideas about actual content and, ways to combat stigma, different myths and stereotypes and things like that, but also ways to present this information that would make the most sense for their communities. And then from these meetings, we used the content that we gathered from those discussions to develop the toolkit, which was an actual hard copy brochure and then also an accompanying website. And once we had those deliverables, we then went back to each of our community partners and held showcases during which different community members could share their personal experiences with mental illness stigma, their stories, and really just celebrate that we brought this full circle and officially distribute the toolkits.
I've seen the website. It's really impressive, and you have a lot of great resources on there.
Thank you.
Um, so what was your target audience for the project, and why did you choose that demographic?
Yeah, so as Dr. Gonzales said, we worked with BIPOC communities, and our focus was BIPOC communities because BIPOC communities have and historically faced a lot of marginalization and discrimination and have been underserved when it comes to mental health. And there are some pretty low utilization rates, unfortunately. Fortunately, though, society as a whole has become more open to the concept of mental health and the fact that it exists compared to a few years ago. The stressors and trauma of the COVID-19 pandemic made it really hard to deny that mental health exists and that mental health is important. And more people started seeking services. More BIPOC individuals sought services too, but we continue to see lower rates of utilization. There's still a lot of systemic reasons for that, but stigma is a big reason for this underutilization. And a lot of the stigma does come from the systemic factors. It's important to understand that stigma is not just about ignorance or lack of awareness. A lot of it has to do with with folks having negative experiences with healthcare systems. So folks in BIPOC communities definitely have mental health challenges as a result of their experiences. But because of stigma, tend to utilize mental health services, again, at lower levels, and as a result, experience worse mental health outcomes. So folks need treatment, but aren't getting it. So we wanted to create tools to address this stigma and hopefully encourage folks to get treatment.
So before you established a focus and approach for this campaign, did you conduct any early stage research such as focus groups, interviews, or community outreach efforts to better understand the needs of your audience?
Yeah, definitely. So as Dr. Collins mentioned, this was really a key part of the design of our project. So we wanted to use this participatory design where the people and communities that our toolkit was meant to benefit had active involvement in the project, really from start to finish. And this was important to us, from a standpoint of collaboration and inclusivity, of course, but also because we, have this awareness that historically, and especially with regard to mental health and psychiatry in marginalized communities, um, so often, right, policymakers or researchers or clinicians will come into these communities and take and, do research or do whatever, and then they'll leave and they won't come back, right? And so that only really perpetuates the mistrust in those communities, especially when, they're not being involved in the services that are meant to help them. And so with mental illness stigma, it's especially an important area where it's really crucial to involve lived experience in order to really avoid perpetuating those power imbalances and exacerbating the problem. So if we're really trying to create services that are culturally informed and meant for a specific population, then members of that population or that community should be involved in the conversation from the very beginning.
Yeah, and the other thing is that so often clinicians and researchers have ideas about what is best for the community. And a lot of times that's just not right. There are a lot of things we know, but there are many, many things that the communities we work with know, and they have a lot of wisdom that we need to be listening to, we need to be asking for.
So what type of mental health stigma, such as self-stigma, public stigma, structural stigma, and institutional stigma, do you feel your mental health anti-stigma campaign has been most effective at positively impacting?
Yeah, well, the community members we talked about focused mainly on self and public stigma. So that's what we ended up focusing on. And that was in line with our goal of sharing information about mental health stigma, mental illness stigma, and challenging misinformation and misconceptions. So a lot of the website and toolkit, and we will show the website in just a little bit, are devoted to sharing sort of foundational knowledge about what mental health is and why it's important, what stigma is and why it happens in BIPOC communities and what it might look like, how we can fight stigma, um, and also sharing resources about how to access services and also other tools for addressing mental health. So therapy is and traditional treatment are definitely one means of addressing mental health, but there are so many other ways that are accessible that are the community members talked about. So we did include information about those things. So we think that the information really has the potential to help a wide range of folks. So those who have some familiarity with mental health and mental illness and stigma, and those who want to address their mental health. And also it could be helpful for those who have less knowledge about uh, stigma, mental illness, and ways of addressing it. So as Dr. Gonzales mentioned, we held these community showcases. And one of the reasons for this was to share back with the community what they had given us. But the other goal really was to share information with the wider community. We wanted the broader community to know about these resources and be able to access the information.
What were what were the anticipated results and deliverables expected from this project?
Yeah, so as we mentioned, the deliverables included a hard copy toolkit.
Hmm.
That was a brochure, essentially, that, contained a lot of the information that came up through the community meetings. And then an accompanying website where we were able to provide a lot more information. And, on the hard copy toolkits, there's a QR code that you can use to go to the website. Um, and the website and the toolkit, we were able to create both of them in English and Spanish language, so that, folks from both communities would be able to access the information. And then we held those community showcases in order to distribute the toolkit to the wider community within our partner locations. But also, they ended up being a really nice opportunity just to share stories and talk about, what it's been like, people's, individual stories and narratives of their mental health journey, and how their mental health journeys, involved a lot of connection with different community members. And so a lot of it was kind of really full circle from what came up in the initial community meetings and what we were able to, distribute at the community showcases.
I
Yeah.
imagine. Oh, go ahead.
Yeah, I'm sorry. It was also just an opportunity to celebrate what the community members had done. We helped to sort of arrange and facilitate, but they really were the source of the information. So we wanted to share back with them, what they had done.
Yeah, I imagine it was two-way, and that it was wonderful for you to hear their stories, but I'm sure they were happy to have someone appreciate and listen to, their individual stories as well. So what were the outcomes of the project, and were there any surprises for you?
Yeah, so was the toolkit that we distributed with the QR codes that link to more information, as Dr. Gonzales said, and then the website itself. Um, in terms of surprises, I think that one of the things we wanted to do with this project was come in with sort of open minds and not have a lot of expectations and not let the project be guided by our expectations. So from that standpoint, there wasn't anything that came up that surprised me. I just wanted to be open to what the guidance of the community members.
I would agree with that. I think it was really nice to see things really just develop over time with the different community partners, and a lot of that was dependent upon the members of the communities. So it was good to see that process play out over the year.
Yeah, it was.
So would it be possible for us to take a look at this website?
Yeah, absolutely. Let me pull it up. Yeah, so this is our front page here, and I want to thank both of our designers, our graphic designer and our web designer. But yeah, you see here we have the tagline for New Yorkers by New Yorkers, because that's really what it was, for the people by the people. And if we scroll down, we see sort of a just introduction to what the website and toolkit are for, and overview of how they were made. So we talk about the process of having the community meetings and name our community partners. This is us, the Dr. Gonzales and I, and our designers. And I'll go back up to the top. And here we just have tabs on the different sections. So there is just sort of the foundational information about mental health and mental illness, how common mental illness is. And we have a graphic here showing that, you know, if you were to look at the Yankee Stadium, there are all these people who have a mental illness. So it's a significant part of the population. It's not as uncommon as we might think. And then how does mental illness affect BIPOC folks? Here there are some there's some information about how stigma affects people, how it happens, and then there's more information that folks can access. And then we have myths versus facts. So if you click on this, let me see what happens actually. Yeah, it takes the viewer to myths versus facts. So yeah, these are just a lot of misconceptions that folks have that we wanted to correct.
And the myths versus facts, that was a really big, I mean, all of this came from the community discussion meetings, but this was a really big part of what community members were saying, was that there are many different stereotypes and, you know, negative attitudes that they noticed in their communities or even believed themselves before they, you know, learned about their own mental health, that they thought it would be really important to address in a community toolkit.
Mm-hmm. Absolutely. Yeah, and then we have more resources. So it talks about options, different options for getting support with mental health. So we have information for different racial groups, different BIPOC racial groups, information about health insurance, because that was something that came up, that it can be difficult to navigate that. So where can we get information about that? And then we have hotlines and helplines. So there's a fairly long list of resources that would apply to our communities. Folks asked about rights. How do we find information about our inpatient and outpatient rights? So this is a link to more information. And then, as we mentioned, folks talked about the fact that therapy is not the only way. It's not the end all be all for taking care of mental health. So what are some of the other options? And folks talked about art and mindfulness. So we have some links here that are specific to New York that have to do with coloring and art. And then mindfulness was mentioned. So different apps and different resources we have here. And then information about fighting stigma. So this has to do with more information that folks can get about stigma, mental illness stigma, and also these organizations can help folks to get involved in anti-mental illness stigma efforts.
And it looks like you can translate this whole website into Spanish.
Yes, that's correct. So thank you for reminding me of that. So yeah, it's all available in Spanish also. So any of the information that is on the English version is on the Spanish version as well.
Thank you for sharing. There's so many wonderful resources here.
Thank you. So during our community showcases, as Dr. Gonzales mentioned, we had community members talk about their lived experience with mental illness or mental health more generally. And fortunately, we have a video of one of our speakers, and he has graciously agreed to let us share it. So yeah, we would like to take a look at that.
Good afternoon or good evening to everybody. My name is Ty, Tyron, Titan, depending on how you know me, where you know me, where you ask. Today I wanted to come talk to you guys about mental health and why it shouldn't be stigmatized and why it's so important and prevalent, especially in places like the inner city, right? My mental health journey started, I guess, back in 2019, where right before the pandemic had started, there was a bunch of things going on. I was having a bunch of losses in the family. My father had lost his girlfriend. My dad had, my mom had lost her boyfriend. I lost an aunt. I lost a mentor. I lost another friend of mine, all in the same year. And then the pandemic essentially happened, you know. But during that course of time, I realized that I wasn't quite in tune with my thoughts. I wasn't quite acknowledging the things that I was thinking of, even though if I was thinking of them, you know. And so I would kind of just go on my day-to-day adventures, not too much acknowledging what I was thinking, but kind of just still feeling the effects of what I'm thinking, you know. And it came to a point in which I felt like I needed to talk to somebody about this. And I would talk to my friends, I would talk to my family, and it would help. But I felt like I needed that unbiased opinion of someone who didn't quite know me as personally and can talk to me from a stance of just that. So I had then got myself into therapy. It first started with a program called NAMI, which was in, I believe, 42nd Street. And it was like this sort of like AA style, like you sit around in a circle and people kind of share their experiences and what they go through. And the first couple of times that I went, I didn't share, I just went there to listen and feel out the experience and kind of go with this idea of like, well, this may not help, but at least I can be around people who may be going around similar things, you know? And so I went to one session and I brought a friend of mine, my brother, and he actually encouraged me to speak a little bit, because by him being there, it showed me, okay, maybe it's okay to be in spaces like this, you know? So with his support, I ended up sharing some of my experiences while I was going through that year. And after that, it kind of snowballed into the sense of like, maybe I want more of a one-on-one therapy session. And then I started going to therapy, and now I'm about 4 years deep. And I feel as though that it's helped me a lot. Just, again, understand my own thoughts, my own internal processes, understanding that voice that may tell you like negative, or it may tell you that you can't do something, or it may tell you that you're not worth it. It's therapy that allows you to really examine this voice a little bit more and get to know it a little bit more. So that's been some of my journey, and I feel like that part of therapy is, yes, learning more about yourself, but learning more about yourself, which allows you to learn more about other people, and that allows us to ultimately help one another. There's a quote that I guess I'll end with by Killer Mike that says, if we all do a little, then none of us have to do a lot. And I truly believe that by going to therapy is us doing that little bit that leads to us doing a lot.
So was there an opportunity to measure the impact of your work? If there was, how, considering both the qualitative and quantitative aspects?
Yeah, absolutely. So on the quantitative end, the nice thing about having the website is that you can look at the website analytics over different periods of time. So we're actually able to see, the types of hits that we're getting, how many, where they're from, all of that quantitative data. So I'm going to pull that up now. We can see, we launched around May of 2023. And you can see the hits really went up quite significantly. And, over time, there hasn't been any, linear decrease in hits. And so that's been kind of nice to see that, there's been this pretty sustained interest. And that tells us that people in the communities that we worked with, are still talking about it and sharing it and interested in, the content and the resources that we put together. You can
Sure.
see these different tabs, the sources of, how people are getting. So a lot of them are direct, right? And some are kind of people are actively searching for We Speak New York City. But the fact that, the majority of hits are direct hits also, speaks to the word of mouth, I think, which is so important in these communities is, the word of mouth referral. And then in terms of geography, this has been interesting as well. So the majority is obviously people from the United States coming to the website, but it's not only United States. So our reach actually was much further beyond these communities, actually. So we have, a few from Canada, from Puerto Rico, from, several other countries. And, I think that can also speak to the diversity within these communities that we are working with as well. So the fact that we were able to reach beyond, geographically beyond the communities that we were working with was pretty nice to see as well. And then in terms of additional data from the community showcases, we actually collected some initial feedback from community members who attended. So I can just take us through quickly what that looked like for the responses that we got from folks. And so here's, we were able to show those brochures, the hard copies. And here's some of the photos from our community showcases. So this is at Services for the Underserved in East Harlem. And this is from the South Bronx partner location, Montefiore. And then we gave Toolkit evaluation forms to folks at these meetings who are willing to complete them. And so, this table just shows some quick demographic breakdowns from people who attended. And then we asked some questions, right? So we were interested to know what, if anything, people liked about the toolkit. And here are some examples of what people shared. So they really appreciated the information, actual content, but also, the awareness that, the toolkit was bringing to issues of mental health that were very important to them and for their communities. We got one piece of feedback that, visually maybe too many QR codes going to the website, but I think the most important was also questions about whether we'd be able to translate this into even more languages so that we could distribute them to even more communities, which we would love to do if given the opportunity. And then, even more resources. So one of the great things about these community showcases is that, there were even more ideas about like, well, what next, right? What else can we do? What could we add? What other communities could we distribute the toolkit to? So this is something that I think could easily continue if given the chance, which I think just speaks to the strength of the collaboration and the interest in these communities. And then, people shared what they learned from the toolkit and participating in the collaborative process. And, people were pretty appreciative of the resources, the discussion around the prevalence of mental illness, and, just the importance of being able to talk about it in their communities. And then they had a lot of ideas about, people who could benefit, who maybe don't know much about mental health or aren't connected to services. So, different people in the community, also professionals in mental health would potentially benefit from something like this. So it was nice to see, that people had ideas, about different people who could benefit. And then people, also talked about different, community members that they would want to share the toolkit with. So friends or loved ones, family members, their own treatment providers, but also different community leaders, such as, religious leaders or other members of their community.
Thanks for sharing that data. It's really very interesting. So drawing from your experience reducing mental health stigma in the community, what recommendations would you give to other agencies looking to implement their own successful anti-stigma campaigns?
Yeah, so we definitely recommend the community-based participatory approach. Again, that approach helped to ensure that the information feels relevant and useful to the community. When using that approach, it's really important to keep an open mind and be flexible because, as we mentioned, you might have your own ideas about how things are going to go, but when you're collaborating and it's a true collaboration, you have to keep an open mind about how things might go and really be willing to share some of the power. And that can be difficult for those of us who are clinicians and researchers and used to doing things in a particular way. But that is an essential part of it, just being open-minded and sharing power. It's also important, related to being flexible, is being flexible about timing. So a lot of community-based organizations have limited resources in terms of time, energy, money even, and so it's important to be able to account for that and work around and leave a lot of sort of wiggle room because things are not going to go according to your schedule. Again, these organizations have a lot of different constraints, even with all the strengths they have. One thing that we really would have liked to have done, but weren't able to do because of constraints, is to co-collaboratively or co-developed the proposal with our community partners. So Dr. Gonzales and I made the decision that we wanted to do a website and toolkit with this particular focus, but had we had more time and been working with the community partners from the beginning, we would have developed and written the proposal with them. So it can be really nice to, actually apply for the different opportunities with the community partners.
Well, thank you for sharing with us about this project and showing us the website. We've learned a lot, and if anyone is interested in replicating something similar, please reach out to Dana and Lauren. Thank you both for your time.
Thank you.
Thank you.